Hi everyone, my name is Mavish. Firstly, I'm really sorry for not being able to make any videos for quite a while now. I was just super occupied with my work. Anyway, I am back and today I'll be discussing about one of the most common problems, that is bleeding gums. So what it means to you and how you can prevent it from getting worse. Before we move on, please make sure that you subscribe to our channel to know more about your oral health and how to maintain healthy teeth for life. So have you ever noticed that your gums bleed? Do they feel sore or sensitive? Do they look red or swollen? Is there any bad taste or any bad breath? Any wobbly teeth that you have noticed? Have you lost any teeth because they got loose? If you have noticed any of these, then it's really important that you focus on the coming few minutes. It might be a sign of gum disease, and if this gum disease is not controlled, then it can even lead to tooth loss because obviously the gums are the foundation of our teeth. That's why it is so important to prevent this gum disease from getting burst. And believe me, although there are various replacement options to replace your natural teeth, but as such, there is nothing in the world that can replace the value of your natural teeth. That's why it is so important to protect it from any damage. Do you know what can be the cause for gum disease? Our mouth is a home to millions and thousands of bugs, and there is always this sort of fight going on between these bugs and our mouth. Do you want to see how? Whenever you have any food or drink, there is this sticky thin film of bacteria that constantly forms on your teeth, what is called as plaque. But the good thing about this is that it can be easily removed just by brushing. That's why it is so important to brush your teeth twice every day. And to know the most recommended method of brushing, please make sure to check out this video. I have also attached the link in the description box below. Because if we don't brush effectively, this plaque will build up further and mineralize into a hardened substance called as calculus or tartar. Now, this cannot be cleaned just by brushing. And to get rid of this, you will require a professional clean. And to be honest, we are all humans and we may not be up to mark while we brush every day. That's why what I suggest is to have a professional clean at least once a year. Now, apart from plaque and calculus, your general health condition also contributes towards gum disease. That's why it is important that you keep an eye on the following risk factors like diabetes, smoking, stress, cardiovascular diseases, stroke, pregnancy, dry mouth, and genetics. That is, sometimes it runs in the family. Let's see what are the signs and symptoms. So it depends on the stage of gum disease. I'll be talking about the stages in a while. So initially you may feel that your gums are looking red and swollen. They may bleed easily, particularly on brushing. Also, the gums might start shrinking. There can be some bad taste, bad breath, leading to formation of deep pockets. I'll be talking about pockets in a while. And if this is not controlled, then ultimately the tooth might become wobbly and eventually fall out. So if you notice that your gums are bleeding, it might be actually a way of your gums to say that they need your help. Now, mind you, it is not always like this because particularly in people who smoke, their gums will not bleed easily because of the reduced blood supply to the gums. But actually, their gums might be in a very bad state. Now, this is really interesting to note that only when the gum condition is in the initial phase, it can be reversed back to normal. Because once it has progressed to an advanced form, it becomes a lifelong gum problem and it cannot be reversed back to normal. So our aim will be just to prevent it from getting worse. Let's have a quick look at the stages of gum disease. So the first picture you can see is of a healthy tooth. You can notice that the gums look quite healthy, they're intact, and the picture on the right side is of gingivitis, which is an initial form of gum disease, wherein just the superficial layers of the gums will get affected. The next picture is of periodontitis, which is a severe form of gum disease, wherein you can see that the underlying bone also starts getting damaged and there'll be formation of deep pockets. Pockets are nothing but like a shirt pocket wherein there'll be gap created between the gum and the tooth. This is where the bugs will sit easily and start eating away the bone around the teeth, leading to advanced periodontitis wherein the tooth might become wobbly and ultimately fall out. Let's see what is the treatment for gum disease. First and foremost, maintaining a good oral hygiene is absolutely important. Make sure that you're brushing your teeth twice every day. Spend at least 2 to 3 minutes to clean on all the surfaces of your teeth. Now, do you know that by brushing you can just remove about 60 to 65% of the plaque? The rest of the plaque is in between the teeth, which cannot be removed just by toothbrushing. Here comes the importance of using a floss or the tiny brushes called as the interdental brushes to clean in between the teeth. Next is to have a well-balanced diet. Have a lot of fruit and veg. It's really good for your health. And avoid having any sugary stuff because the bugs in your mouth will feed on these sugars and they will produce acids, ultimately causing cavities, gum problems, and whatnot. That's why keep the sugary stuff to minimal as far as possible. Next is to have a thorough cleaning of your gums at least once a year, as I mentioned earlier, because by doing this, we can minimize the chances of progressing to a severe form of gum disease. Next is to visit your dentist regularly, that is every 6 months to 1 year. However, if you have a severe form of gum disease, your dentist may recommend you to visit every 3 months until the gum condition is stabilized. And on every visit, basically the dentist will be checking your gums, do some scoring, that is BP, basic periodontal examination, and on every visit this investigation will be repeated. So basically it will allow us to see if your gums are healthy, if they are getting better, or if they're getting worse. Next is to prevent the risk factors. Now, smoking is not good for your oral health, neither for your general health. It is one of the major risk factors for gum disease, lung cancers, oral cancers, breathing problems, and so on. Finally, it is important that you manage your medical conditions because your general health can impact your oral health. So I would strongly advise you to meet your GP or doctor regularly and make sure that your diabetes or stress is well under control. That's it for today. Thanks for watching. We will be back again next time to tackle another common dental problem. Until then, take care. Bye.